Welcome to Retiring Today. We're tackling one of your biggest concerns, healthcare costs in retirement. You've worked hard, you've saved diligently, and you don't want these costs to derail your retirement. That's what we're here to help you avoid. We'll cover 3 healthcare traps and how to avoid them, including failing to plan for extra costs, underestimating Medicare premiums, and ignoring long-term care needs. Hi, I'm Molly Nelson here with Anne Marie Morrow and Lauren Merkel. Anne Marie is the Director of Medicare and Long-Term Care at Merkel Retirement Planning, and Lauren is a certified financial planner and a certified financial fiduciary. First, let's establish the presence that is Anne Marie Morrow, because it's so great to have her as part of a team, and I want to make sure everybody watching understands exactly her role at Merkel Retirement Planning.
Not only is it a huge benefit to us, it's a huge benefit to the families and individuals that we serve, because our retirement planners get to work side by side with Anne Marie to help make the decisions around healthcare. One of the top topics that we get questions on is, what do we do with our healthcare decisions, whether they retire prior to Medicare age 65 or certainly once they do get to Medicare age. There's a lot of questions, and the ability for Anna Marie to work hand in hand with our planners allows them to make a cohesive plan, because decisions that the planners make with the retirement plan will impact Medicare decisions and vice versa.
Yeah, it's not an extra phone call or an extra visit to an outside agency of some sort. She's right here in-house, and she's here today to talk about these healthcare traps and how to avoid them.
And we do have a lot of fun looking at that together, because healthcare is, if not the first, then it's the second anxiety-causing topic when people are facing retirement. The first is, do I have enough money to retire? But then the next is, what's healthcare going to cost? Can I retire at this time? And when it's side by side with a retirement planner and they can see how a healthcare decision fits inside their overall plan, that's when we have some fun as we see that anxiety wash away.
And you put the fun in healthcare. I hear that time and time again from families and individuals that we serve.
There's no F in healthcare.
Today there is.
Okay.
And Anna Marie puts the fun in healthcare. The anxiety that people have as they walk into that conference room, you can see a noticeable difference when they walk out of that conference room. What a relief for those individuals and families who now have a plan, a healthcare plan that works really well with all other aspects of their plan.
You know what's fun? Helping people avoid traps, because no one wants to feel trapped or feel confined as they head toward retirement. They want to have all the right information so they can make all the good decisions. So that's what we want to help you do today with these healthcare traps and how to avoid them. Healthcare trap number 1, failing to plan for extra costs in retirement. And I think people have a lot of misconceptions about what's covered by Medicare and what's not, and the out-of-pocket costs can be a little bit daunting.
Yeah, I don't know how you avoid the misconceptions on your own, because the legislation changes all the time. But the truth of the matter is, a couple age 65 could face up to $300,000 of lifetime retirement time cost on health care alone. And that is a daunting expense number, especially when that's not one of the first things you want to spend your life savings on. You want to focus on the fun stuff of retirement, the stuff you've been dreaming about all this time. But then here comes a health care event, or just paying the premiums on the said health care can be daunting. And you look at that total health care bill over the course of retirement, it could be a lot.
Yeah, I've read some studies, somewhere from $200 to $400 out of pocket, depending on a lot of things. But that may be a surprise to some people watching. How does it happen? How are these numbers added on to the total?
I love that we're talking about this today, because this literally just recently came up with an individual that we work with. He's aging into Medicare, and he saw this study where he saw, is it going to cost me $300,000 in retirement for healthcare costs? So we broke it down, right? So his retirement outlook, we're going to base this on a 20-year outlook. So we broke it down to what premiums are, and we showed him different supplement options. But when he heard $300,000, it's like, okay, if I get this diagnosis, is it not covered? Like, why is it costing me so much? So when we look at that 20-year time frame, it's about premiums, it's about out-of-pocket maximums, drugs. The cost of medications was a big concern. This study was released in 2024, prior to there being an out-of-pocket maximum on drug cards. Well, under the Inflation Reduction Act, we do have this $2,000 out-of-pocket maximum for this calendar year on drug cards, which can take down that cost. But then if we're looking at dental, right? Dental's not covered under Medicare. You needed more coverage for that. but then you're going to have your copays, vision insurance, and then the big one is long-term care. Medicare only pays up to a certain amount of days every year, at which point long-term care would need to come into play. So that number, that 300,000, that can sound so scary and daunting, but when you break it out to what those costs are, you do have medical coverage. If you get a diagnosis, you do have that coverage if you have the right supplement in place for you. And that's what we talk through with the families and individuals we work with.
Yeah, and that's why the trap isn't necessarily the cost, because we know the costs are there. There's nothing we can do about that. But the trap is failing to plan for the cost. So let's help people avoid the trap. How do you plan for the cost in retirement?
Yeah, it needs to be a part of the overall retirement plan. As a part of that retirement plan, you need to plan for income. It's more intuitive to know that when you retire, you give up your W-2 income, you still need to have income coming in to support your lifestyle, but now it's going to come from the money that you save, the investments that you have. But how does that income pay for your lifestyle, but also pay for the healthcare premiums and the healthcare events that you have coming into place? If you have that income and the healthcare expenses planned for in that income plan, that will make you feel a lot better when you do have a healthcare event. It's also going to make you feel a lot better along the way because you can see how you're going to be able to afford the healthcare premiums, not only now, but also 5 years down the road, 20 years down the road. And so baking the healthcare plan into the income plan goes a long way to help with this.
And it's not just the income component either. We have all these overlapping components. The lifestyle component, for example. What are your goals within retirement? Do you plan to travel? Do you need to look at networks in other states? Do you want to snowbird in a different state? All of this plays into where we don't have to make a siloed decision for your healthcare coverage when you enter into those retirement years.
Yeah, that even makes me think about those who want to retire before they're Medicare eligible. We know a lot of people are ready to retire at 62 or 63, but they think they've got to keep going because they have to wait for Medicare. And a lot of time you sit down with them and say, hang on, let's look at this. What if we did pay, we use Cobra, or we did pay for the marketplace, and you show them how they can make it happen. Those are some really fun conversations.
And there's the
powerful.
fun. That's the fun.
There's the fun.
There's where she puts the fun in it.
That's the fun, and it's so powerful in those moments because people at that point are ready to take charge and enjoy their go-go years.
Taking charge is a lot of fun, and one way to take charge is to take the first step. Here's a great idea. It's a retire ready call. You can talk about healthcare. If you've got costs or questions rather about healthcare, we can answer those, or talk about the investment or the income or any of the things that we're talking about today in this show. It's a casual conversation. It's complimentary, and you can schedule a retire ready call by going to retirereadycall.com right now. There's a calendar. You choose a time and a date that works for you. We have got 2 more retirement healthcare traps to talk about next. Welcome back to Retiring Today. We're talking about healthcare traps to avoid in retirement. Healthcare trap number 1, we've gone over it, failing to plan for extra costs. Now it's time for number 2, underestimating Medicare premiums. I'm Molly Nelson here with Anna Marie Morrow and Lauren Merkel, and we talked about that number. Some $200 to $400 a month out of pocket, just on a baseline level. And really, if you look at the average premiums for Medicare, that's how you get to that number pretty quickly.
And that's just for Part B. You know, original Medicare A and B. Part A, your hospital insurance, there's no premium as long as you or your spouse have worked the qualified number of quarters. But Part B, we can always depend on there being a premium for that. And for 2025, the base premium is $185 per person. And then on average for Part D, an average premium is around $37 a month.
Yeah, so if you add those together, take them times 2, that's how you get to up over $400 a month. And that's baseline. Let's go through a little bit more than baseline because we know a lot of this is income based. There's an acronym that we use to kind of decide what people pay. And I mean, the biggest number on that is $628 a month.
And this is the biggest trap. This is the one we hear about all the time because it's not that long ago where Lauren and I sat down with someone who was ready to retire. This was the first time we were meeting with them, and they sit down and they had an idea of what their net expenses were going to be in retirement. They even knew what the baseline Medicare premiums were. They took a stab at the supplement. And then as we continued that conversation, as we went through what their tax planning had been, what their income planning had looked like, they were going to pay over $500 a month for each of them. And the natural progression of the conversation at that point is, well, can we afford to retire at this point?
Yeah, that's a lot of money. Let's kind of talk through how it works and how income is tied with Medicare premiums.
And this is a surprise for a lot of people because a lot of people, in calculating their tax and how the tax implications apply to everything else, use their taxable income, which is the income after the standard deduction for most people, or itemized deductions if you have them. But the cost of your Medicare premium is actually before those deductions, so it's your gross income. And if you're just $1 over that income band, you are paying that higher premium. And that's not like the other tax implications. If you're $1 into another tax bracket, the $1 you pay that higher tax bracket cost on, and that's not like Medicare. So there's a lot of room for surprises here, just like the couple that we met with a couple years ago. And that was over $500 a couple years ago. What's it at?
The highest tier today is over $600.
Yeah, so it's significant. It's constantly changing, and that's why it's so important for us to work together on behalf of the families and individuals that we serve to make sure we get it right.
Okay, so they look at the, what'd you say, gross, modified adjusted gross income.
Correct.
That's what they look at, but they don't just look at the year that you're thinking about taking Medicare, and they're going to go backwards and look at what you made a couple of years before that.
Correct. Every year they do a 2-year look back. So if you have that escalated income 2 years ago, but not necessarily the previous year, you're not going to be stuck with that increase throughout the duration of your lifetime because this is reviewed every year. Now, how to avoid that trap? Plan for it. Right? Plan for it, because once people are aware of this increase and we start talking through it, it might look beneficial to pay that due to some income planning strategies or investment planning strategies. Then they're like, oh yeah, no, that makes sense. Let's do this. We're planning for the long term. Being prepared for it and comfortable with that is a big way to avoid falling into that trap.
And that's the big key. We want to eliminate the surprise. So you might have to pay more for your Medicare premium than the base, but at least you know about it. You know about it in advance, and you can plan for how you're going to pay for that so that you can decrease the surprises by increasing your planning.
And when I hear you guys talking about this taxes, investments, income, and all this together, this is where you do sometimes though work together to look at, like, if we do a Roth conversion this year on our side of things, well, how does that affect Medicare? Maybe you would wait to do the Roth conversion, maybe do it sooner rather than later. You guys definitely have some conversations about this.
And that's where there's real power in planning, right? When we can dive into the tax planning piece with people and show them how this will benefit their plan in the long term, where we might need to pay some extra premium in the short term, and they see that power in planning, that's again where the F for fun comes into play.
Yeah, specific example, recently we met with an individual, and from just a tax planning standpoint, it made sense. They had room to do a $50,000 Roth conversion. But we can't stop there because of the implications that could apply to the Medicare premiums. So then we go to Anna Marie and say, Anna Marie, they have room for $50,000 Roth conversion. What's that going to do to their Medicare premiums? And you chime in and say, actually, that's going to push them into a higher Medicare premium. And now it's not an automatic, no, let's not do a Roth conversion. Let's do some more calculations. What's the increased premium difference? And what's the benefit of doing the Roth conversion at that $50,000 level? And then using all of that information, we can really dial in on, yes, let's do the conversion, or no, let's not do the full, let's do a partial conversion, or let's not do a conversion at all. We'll wait until later down the road where income changes to do it.
I think sometimes when somebody's watching, maybe they're 57 and older, this feels like a long way away. 65 feels like, I'll worry about Medicare later, but are there some things at 57 that they can be thinking about or doing that could put them in a little bit better position for some of this at 65?
I mean, just being aware. I mean, education is key, because we always hear that phrase, I didn't know that. And how to avoid any trap is just being aware of where they're located, what they look like, and what the effects long term are. So if you're listening to this, you're 57, Medicare, you're like, oh, that's so far away, I don't need to worry about it. There's a reason Medicare is called the maze of Medicare. It can be overwhelming, confusing, what costs are, but that's where we come into play. We stay up on legislative changes, and we're putting the education out there as we receive it to make that planning even more effective and preparatory.
And by putting that plan together at, let's say, age 57, we can project forward, here's your income at age 63, right? Remember, the Medicare is 2 years looking back. Here's what your income's going to be at 63. Here's what it's going to be at 64, 65 if you work, or if you retire, maybe sooner than what you otherwise anticipated retiring. And that can impact the decisions that you make right now. Maybe it makes sense at the age of 57 for you to start doing aggressive Roth conversions now because you don't have to worry about your income from a Medicare premium standpoint. So maybe you want to step on the gas a little bit now with the Roth conversions and then back it off as you get to age 63 so it doesn't impact your Medicare premiums at the age of 65. All of that should be considered. The earlier you start, the better off you can be.
And knowing what to plan for is helpful. So how do you have this conversation when you're talking to people about the supplemental insurance? What should they be thinking about that?
As far as that goes, it's what you're comfortable with. Now, supplement options, they can also change every year as well. You know, what are all these letters? What letters do I need to be aware of? What letters do I need to be comfortable with? What letters don't exist anymore? Because that is constantly changing. My biggest piece of advice was learn what types of supplements are available this early in the game. Don't worry about cost. Just maybe learn what the two basic options are and get a feel for what you would be comfortable with. And then as your overall retirement plan is being built, you're working on building, accumulating wealth still through your accumulation years, then your plan will guide us to see, okay, what type of supplement fits in your overall plan.
Yeah, that's a good tip. So you can start thinking about healthcare now. You probably are. If you're thinking about retirement, how could you not also be thinking about healthcare and the costs in retirement? You can ask questions about some of the stuff we've been talking about to a retirement planner during a Retire Ready call. It's a casual conversation where you just get a chance to really get information, sometimes action steps that can help you put yourself in a better position for retirement. You can schedule this call right now by going to retirereadycall.com. We have one more healthcare trap to talk about. We'll tell you how to avoid it next. Welcome back to Retiring Today. We're talking about 3 healthcare traps that could derail your retirement and helping you avoid those healthcare traps. We've covered failing to plan for extra costs, underestimating Medicare premiums, and now it's time for trap number 3, ignoring long-term care. I'm Molly Nelson here with Anne Marie Morrow and Lauren Merkel. And really, you can't ignore long-term care. And one reason, Anne Marie, is that Medicare generally does not cover long-term care costs.
It does not cover long-term care costs. When I am sitting down one-on-one with the individuals and families we work with, and we're reviewing the summary of benefits on whichever supplement they go with, part of that summary is explaining inpatient hospital or skilled nursing. You are covered up until day 90 or 100. You do have a lifetime reserve days of 150, so some extra days in there, but that's when it costs. And so a lot of times I'll get a question, well, then what? Then it's long-term care. And when you think about it, 100 days, that's just barely over 3 months. That's not that long of a time period. So that is something that we need to avoid, that trap.
Yeah, it's not that long of a time period when you look at the average stay. So the facts tell us that women need long-term care for 3.7 years and men 2.2 years. Also, the facts tell us that 70% of those 65 today will need some form of long-term care. 20% of people will need long-term care for more than 5 years. So that just really illustrates why you can't ignore long-term care.
Even though it's tempting because nobody really wants to think about a time where they need home health care or they need to be in a facility, and really nobody wants to think about the cost of what home health care or facility care is going to cost them over the long run. So it's easy to ignore or want to ignore, but you can't, because the implications not only can it have on your retirement, but if you're married, your surviving spouse's retirement when you pass away. And then, of course, if you have any legacy ambitions at all of passing some of your assets onto your kids or grandkids, long-term care can really eat into all of that.
Let's dive into the cost. The average cost in the United States of an assisted living facility is about $64,000 a year. Home health aid, $75,000 per year. So really, these are costs that not only you should plan for, they're really expensive. And I know, Anne, where you talk to people a lot about when their spouse passes. What people say to you is, I just really want to make sure that my spouse is taken care of. So how does that conversation go, and how do you help people plan?
It's an important conversation to have, and it is difficult because most of us have seen what someone has gone through caring for someone, and how do we avoid that on our own, because we don't want to be a burden to our family members, our loved ones, our children. You know, how do I leave that meaningful legacy? So you basically have, there's 3 options available out there. Your typical long-term care insurance, which That market is pretty saturated, and we're not finding that kind of long-term care option available.
And as soon as you say long-term care insurance, people are like, no, thank you. My parents had that. The new policies aren't the same, and they're way more expensive. I talked to my friend, and they're paying X amount per month. That's not for me. So it's a turnoff right away when you say long-term care insurance.
Yeah, it's definitely not what it used to be. So now we have these different options moving into that space that can serve a few different purposes, right? It can help us leave a meaningful legacy, like a life insurance hybrid, or there are investment hybrids available where we can accelerate a death benefit should we need help offsetting the risk for long-term care should that need arise.
Yeah, and the old long-term care policies all required underwriting. There's a lot of options today that don't require any underwriting. And then there's some other hybrid options that as long as you're already not in a long-term care facility, you can get some coverage to offset some of that risk. So not only are the coverages available today different from a cost standpoint and a coverage standpoint, but even from an underwriting standpoint, people with serious health conditions today still have viable ways to offset some of that risk.
And do these products that are changing or these options that are changing, does it make it easier to have this conversation? Because I still have to think that there are a lot of people that they're hoping they don't need it, or they're banking on being that 30% that don't need long-term care. But when there's different options available, does it make it easier?
I think it does. I've seen that it does. But also when we discuss that 70% of people over the age of 65 need it, because what the trap really is getting in that mindset of, oh, that's not going to happen to me, right? But when we review with them, 70% of people over the age of 65 will need it for an average of this number of years. Then it kind of gets those gears moving to where we can have that conversation and look at their overall plan. Can we self-insure? Can we afford to self-insure? That is a popular route people go. Or what do we feel comfortable with offsetting that risk? And here are your options that don't require the nightmare of health underwriting that it used to.
And that's really what we outline in the Retire Secure Roadmap is first we look at what is their long-term care risk. And then we talk to them and say, if you have a long-term care event at, let's say, age 78, here's the estimation of how much it's going to cost. Here's what it's going to do to the assets that you have and the income plan that you have. What do you guys think? Is this too much risk? Do you want to offset some of that risk? If so, now we dive into the other options. And that's where the ease of the conversation is way different than 10 years ago, because 10 years ago, we were having that conversation. They were saying, yeah, that's too much risk. Let's offset some of it. Well, then we'd show them what long-term care insurance costs. And they're like, I can't afford that. I don't want to afford that. Today, we can show them way different options that are much more affordable, and they can still offset some of that risk.
Yeah, you brought up the Retire Secure Roadmap. Let's take a look at that. You see healthcare. It is one of the 6 pillars of a comprehensive retirement plan, but let's talk about the other 5 pillars so people understand how all of this works together. We have lifestyle, income, investments.
Yeah, the lifestyle is what you're dreaming of. It's what you want to do in retirement. But what you need is an income plan to help you afford this lifestyle that you want, and then a tax plan, healthcare plan, investment plan, and then, of course, a legacy plan. So all 6 of those pillars are involved in the Retire Secure Roadmap, and it's something that we put together for the families and individuals that we serve. And one of the important components of this Retire Secure Roadmap is it is in writing. Because it's not Anna Marie, it's not me just saying, here's what you should do. Yes, we give you our advice, we give you our opinion, but then you can also see it. Not only can you see it, but you can take it home with you so you can refer back to it. And so if you're thinking about what should you do from a Social Security strategy standpoint or a Medicare planning standpoint or long-term care, it's in your roadmap that you can refer to. And then of course it's updated as your life changes, legislation changes, and the total economic environment changes.
As I think about the 3 traps today, so we have failing to plan for extra costs, underestimating Medicare premiums, and ignoring long-term care needs. None of these were pains in retirement you could completely take away, but it was all about planning for them. And all of our ways to avoid the traps, none of them said sit back and do nothing. Every one of them said take a proactive step. And I can't think of a more proactive step than scheduling a retire-ready call.
Absolutely. And part of that ease of going into retirement and you know, we don't have 100% solution to any of these things, but just having that peace of mind when it does come up, oh yeah, we plan for that. I'm all ready. No, it's fine. It's totally fine. I'm going to pay this much more because I know in the long term I'm set up for success. Having that confidence moving forward allows us to set ourselves up for success so we can enjoy retirement and not feel all of that anxiety that's eating away at the back of our minds like, well, how am I going to handle this when it comes up? We talked about this, but I'm not prepared. You are prepared. And how to start off with that confidence is starting off with that Retire Ready call.
Yeah, it's an opportunity for you to ask questions, and those answers will make you feel that much more empowered as you head towards retirement. It's retirereadycall.com. You can go there right now to schedule a call today. This is Retiring Today, and we thank you for watching.
If you've enjoyed this video, click here for more content. And don't forget to subscribe so that you can be connected with others just like you who are looking for entertaining retirement strategies.